Hello, this is Victor DeRosa with UCF Physical Therapy Program. I'm here to measure Kenneth Minette's knee. First, we're going to do knee flexion, which is usually around 135 degrees of flexion. I'm going to ask the patient to bring his foot up as close to his butt as possible. Very nice. The axis of rotation is the lateral epicondyle of the femur. Our movable arm is going to go straight down the axis of his leg towards the lateral malleolus, and we'll find the greater trochanter for the stationary arm, which is usually 8 inches below the iliac crest. Find that right there. And Kenny has 140 degrees of knee flexion, which is considered normal, even though it's supposed to be 135, with a soft end feel. Now we're going to have him extend his leg and place a couple towels underneath his ankle in order to extend his leg as much as possible. And it's going to be the same line marks for this. I'm going to ask the patient to flex his quad in just a second. Find his condyle. Greater trochanter. And I'll have you flex your quad, please. And he's having -1 or 1 degree of hyperextension, which is also considered normal. And knee extension will have a firm end feel. Now, for a length test for his hamstrings, we're going to do a straight leg raise, in which we'll have the axis be the greater trochanter and the stationary arm being parallel to the trunk of his body. The movable arm, of course, is going to go to the lateral epicondyle of the femur. So, straight leg, of course the leg's going to be straight. I'm going to bring it up until I feel a firm feel. Pretty flexible guy. So, greater trochanter, I can palpate right here. Stationary arm is parallel to his body, and the movable arm will be going to the lateral epicondyle of the femur. And Kenny is getting a reading of 88 degrees, and anything less than 80 degrees would be an impaired muscle length, which means that he would be tight. Now remember, watch for compensation in the rotation of the hips and or lower trunk. We are going to assess Kenneth's strength of his hamstrings, first grossly. We are going to flex his knee at about 50 to 70 degrees of flexion. I'm going to stabilize distally on his thigh, pressing it firm into the table, and come proximally to his ankle and push down into extension. I'm going to ask Kenny to hold against my resistance. 1, 2, 3. And I could not break him from this position, so I would give him a 5 out of 5 strength for his gross hamstrings. Now, in order to test his biceps femoris specifically, I would bring the knee into 50 to 70 degrees of flexion again, but this time we are going to internally rotate to lengthen some of the semitendinosus and membranosus and get the bicep femoris in an optimal length to test some strength. So we're going to do the same thing, making sure my line of force is into extension. On the count of 3, Kenny. 1, 2, 3. And I could not break his position, so he would also get a 5 out of 5 for the biceps femoris strength. Hello. To conclude this tutorial, let's summarize what we have gone over. We assessed the knee joint, flexion and extension through range of motion with the goniometer. We also assessed length through straight leg raise. We also assessed his biceps femoris strength and gross hamstring strength. Thank you.